when these viruses come around, lots and lots and lots of kids get them. So these enteroviruses, many kids get them every summer, and yet only a tiny number get the AFM. We don't know why that is, but it certainly is not the case that every child who gets the virus is going to get the AFM. So that's why there's really not the concern about contagion like that. As I said, most cases we don't find a cause, but the most common causes are viruses. But these are very, very common viruses. So the most important thing for prevention is what we teach to prevent things like colds and flu. So if somebody is sick, they should cough into their, or sneeze into their elbow. And hand hygiene. Most germs are spread by hand contact, even colds and stomach viruses. And so for people to carry around hand gel or wash their hands frequently, when our mothers told us to wash our hands, they were correct. That is the most important thing to prevent the spread of any infection. We worry about our kids much more than we worry about ourselves. And especially about things that seem mysterious, and when doctors and science tell you we don't fully understand it, those things are scary. I think one is, like any infection, the things that we talked about hand hygiene and, people coughing and sneezing into their elbow and trying to not spread germs in the family. I think another thing for people to remember is just the perspective. We put our kids in our cars every day, in the car seats when they're little and in their own seatbelt when they're older. That's one of the most dangerous things that any of us do every day, is get in the car and drive with our kids. Yet, we're generally much more worried about things like AFM than we are about the cars. And so I think people also need to just remind themselves, yes, this is scary. Yes, it can be a very serious disease, but it's extremely rare.